What is an intellectual disability? Intellectual disability or mental retardation is defined as a condition of arrested or incomplete development of the mind, which is especially characterized by impairment of skills manifested during the developmental period. Skills which contribute to the overall level of intelligence, cognitive language, motor and social abilities, etc. Intellectual disability involves problems with the general mental abilities that affect functioning in two areas: intellectual functioning, such as learning, problem solving, judgment; adaptive functioning, activities of daily life, such as communication and independent living; signs and symptoms. Intellectual disability becomes apparent during childhood and involves deficits in mental abilities, social skills, and core activities of daily living when compared to same age peers. Delays in reaching or failure to achieve milestones in motor skills development, sitting, crawling, walking; slowness learning to talk, or continued difficulties with speech and language skills after starting to talk; difficulty with self-help and self-care skills, for example, getting dressed, washing and feeding themselves; poor planning or problem-solving abilities; behavioral and social problems; failure to grow intellectually or continued infant childlike behavior; problems keeping up in school; failure to adapt or adjust to new situations; difficulty understanding and following social rules. Now, what are the most common causes? The most common causes of intellectual disabilities are genetic conditions. Sometimes an intellectual disability is caused by abnormal genes inherited from parents, errors when genes combine, or other reasons. Complications during pregnancy. An intellectual disability can result when the baby does not develop inside the mother properly. For example, there may be a problem with the way the baby's cells divide. A woman who drinks alcohol or gets an infection like rubella during pregnancy may also have a baby with an intellectual disability. Problems during birth. If there are complications during labor and birth, such as a baby not getting enough oxygen, he or she may have an intellectual disability. Diseases or toxic exposure. Diseases like whooping cough, the measles, or meningitis can cause intellectual disabilities. They can also be caused by extreme malnutrition, not getting appropriate medical care, or by being exposed to poisons like lead or mercury. Treatment. Best treatment of intellectual disability is stimulant medications, antidepressants, antipsychotic medications, psychoeducation, occupational or speech therapy,